Opioid addiction is a critical concern throughout our nation. Healthcare workers believe that prescription medication can be a gateway drug to heroin addiction. Reporter Julie BEAULIEU tells us now how the opioid epidemic is affecting Western Massachusetts and what the faith community is doing to help.
Opioid addiction can start out in an innocent way, like receiving an opioid pain medication after a serious injury or operation. Well-known medications like Percocet, oxycodone, Vicodin, morphine, and Tylenol with codeine all contain opioid pain blockers. One local parent says her son started smoking marijuana at age 12 and later started using opioids with other teens in his high school.
I believe it was rampant in his school. Maybe some peer pressure, coping with learning problems, trying to just be one of the regular kids. I don't know.
The faith-based nurses at Sacred Heart Parish in Feeding Hills are part of the Faith Community Nursing Program started by Mercy Medical Center. Deb Bryan-Sesko says her parish is taking a proactive approach. 2 informational sessions, one for adults and one for youths 11 through 21, conducted by the Center for Human Development, or CHD, were open to the community and held at the church.
They used to say it was 1 in 3 families. It's every single family now. It touched my family with my nephew Sean, who, because of drugs, hung himself and will unfortunately spend the rest of his natural life in a long-term care facility because of widespread brain damage. And this is where it can lead these kids. This is what propelled me to bring this topic to my parish.
Wow. Is it possible that opioid addiction is that widespread here in the Diocese of Springfield? I sat down with nurse manager Darlene Biggs, who runs the Faith Community Nursing Program, to get more information.
Statistically, between 2014 and 2015, there was a 30% increase in opioid-related deaths.
Why are opioids so addicting? What occurs in the brain chemistry? And why do some become addicted while others do not? Dr. Roos at Providence Behavioral Health Hospital has some answers.
Opiates are a very powerful group of medications. Opiates are a class of medications that have been around for a very long time for the purposes of treating pain. But one of the properties that they have that can make them so addictive or have such a potential for addiction in certain individuals is that they will activate the brain's reward system in a very powerful way. And so with repeated exposure to opioids, the brain becomes used to that exposure, and then when that opiate is no longer available, it can result in a very powerful withdrawal syndrome.
Historically, morphine was first used to treat pain in the U.S. during the Civil War. Not only was it used then to treat physical pain, but it was also used to treat soldier's heart, what is now known as combat post-traumatic stress disorder, or PTSD. Many soldiers developed an addiction. So why do some people become addicted while others do not?
Certain individuals will be genetically at risk of developing an addiction to a substance, and even specifically with opioids, are at risk because they may experience the medication differently than someone else. Many people experience taking an opiate as a very uncomfortable, unpleasant experience. They get nauseous. They sometimes feel a little bit out of themselves or a little cloudy, and they say, that's something I would never want to touch again. And other people, when they take it, they have a completely different reaction. They feel euphoric. They feel a sense of elevation, of improved mood, improved energy, and it really kind of completes what perhaps may have been a void kind of prior to that.
Is it true that 1 in 6 teenagers admit to taking prescription drugs to get high or change mood?
Yeah, so that's a common statistic that's talked about across the country, and it represents about what the rate is of individuals who have used a prescription drug in the last year for a mood altering or other purpose. And so what we know now is actually that prescription medications are the second most commonly misused substance after marijuana across the country.
After Sean's parents fought a long battle with the public school department in their town and with local pediatricians, he was eventually diagnosed with ADHD and depression. Into his 20s, Sean struggled with rehab and treatment programs and continued using. When his father was diagnosed with terminal cancer, he began stealing OxyContin from the medicine cabinet. His father passed away in 2006. In 2009, Sean attempted suicide by hanging.
Unfortunately, Sean ended up in jail, and he was discovered in a cell.
Sean was resuscitated, and for several weeks, his family did not know if he would live or die. He suffered severe trauma.
He's got a severe anoxic brain injury. He's quadriplegic, he has a G-tube and a trach, and he's totally dependent upon everybody for everything in his life.
The path of an opioid addict is relentless. Many end up dead by overdose, suicide, murder, and car accidents, while others struggle with several attempts at rehab, incarceration, and social stigma. What our state has been doing to resolve this issue isn't working. How can this change? How do we better fight this disease of addiction? Learn more in my upcoming segment on prevention. This is Julie Beaulieu reporting for Real to Real.